Yeah, you know, for women trying to get pregnant. So I also tried to be vegan and vegetarian. I almost died doing that. It was bad. That's not for so, and I found that women that are trying to conceive, the ones that have the worst cycles are the ones that are vegan and vegetarian. And so when we're able to clear that up and they're able to eat in their life, we can fix them. Now that's not like junk meat, like eat good quality meat. And I know you eat quality meats. And I that.
Except the occasional Popeyes issues that I have, but I don't have that issue like that anymore.
And it's okay every once in a while. Look, every once in a while, in moderation, things are okay in moderation. Right. Just the continual lifestyle of it. So for me and the women that I've worked with, I've seen more issues with people that avoid meat. Vegans and vegetarians have the worst time. Their cycles are messed up more. That's just what I've seen in my practice.
I love eating really healthy, so it's made it really easy for me. Like choosing to eat greens and like choosing when you learn how to make the food the way you want to, and realize like you're not like addicted to food, because I do think there's a thing where like you're like it doesn't taste the same, so you don't think it tastes good, but you have to be open-minded. Oh, hi Michelle. I have an issue I would like to address if possible. Please ask the question, Queen. You can do it privately or right here, whatever you want in the questions. We are here to answer your questions. This is why we have Dr. Vita. Please, I am so happy that you guys are taking this this live seriously and like asking your questions, because as Black women, as people of color, there are so many of us that are in need of answers, and you have this amazing doctor here. P.S. If you're not following Dr. Vita K, go follow Dr. Vita K at Dr. Vita K right now, and make sure you go ahead, message her and get into that detox, because the best thing I ever did was detox. Oh, can you add me on live? It's too long to. Yeah, of course. How can I do that?
I don't even know how to add a third person. I mean, I've seen it before.
I've seen it done. Can you send me a request, Michelle, please? Send me a request and I will absolutely let you in. I think you may have to go out and come back in, and then I'll absolutely let you in. But I absolutely would love it. Yes. Are you okay with that as well, Dr. Vita?
I'm okay with it. Come on.
Yeah, of course you're okay with it. You're always ready to help us. Okay, so Dr. Vita, my other question about infertility is, what about the women that, because your whole thing is you help women get pregnant naturally.
So let me pause. I have a few women, about 5 women that are going through IVF that I'm helping prepare for IVF. For example, there's one, she's 45 or 46. She doesn't have a significant other, so she doesn't and her IUI failed for IVF. So I help women prepare for IUI. But of course, my first route is for them to go natural. But some women have to go IVF just because they don't have a spouse, a husband, or a boyfriend.
Oh, okay. Great. All right. Now we have Michelle here. Go ahead, Michelle. Ask your question, Queen.
I can't. Okay, because I can't. I'm trying to like move the screen so I can see you guys, because I can't see my face.
Oh, we see you though.
I'm. That's why I'm just. Oh my God! I'm trying to move the screen down.
You look great. We see you. Oh no! I think she accidentally left. Are you back?
I don't know what happened to her.
I don't know. She'll be right back. All right. So, Dr. Vita, until she returns, I want to know, when it comes to women with IVF, is that something you welcome as well? Because I didn't know that was something you welcome. I thought, you don't understand the natural birth and I don't understand that language very well.
So I'm here to support women on their journey. For example, so I met with one, I'll choose somebody that I met with today, one of my clients, for example, today. So she came in and she was like, I have IVF already scheduled for June. I need you to get me ready for that IVF because I failed the first one. So I'm not in the business of saying don't do IVF. Like, I am here to support you on your journey. If you want to do things naturally, I know how to do things naturally. If you want to do IVF, I'm here to boost your fertility so you can undergo IVF.
Okay.
For
That's
women
good to
in
know.
the way. So there's some women that cannot have natural births just because maybe there's some erectile dysfunction issues. They don't have a spouse. There's some other things that play a role as well. Or maybe there are situations where there's a homosexual couple, situations like that. I'll help boost fertility for anybody. But I'm here to support whatever you decide. I'm not convincing anybody to do anything. Whatever you decide, my job is to boost your fertility and get you pregnant.
Do you have 3 foods that women should probably not have that much if they want to have children or remove fibroids naturally or start having regular periods?
Number 1, do not ever for the rest of your life have 1% low fat, 2% skim milk, any of that. 2% milk, skim milk, blah, blah, blah. The process of removing the fat from milk actually hurts your ovulation. So I have scientific studies that show that. If you're I have a Facebook group too, and I show the data for that. So avoid skim milk, 1%, 2% milk.
Is that included in like ice cream and stuff?
I don't even know ice cream that's like 1% or 2% ice cream. Can you make ice cream like that? I thought you have to have the fat in the ice cream.
I don't know anything about ice cream. I just want to know. I know when I hear dairy, I think of the people suffering from ice cream desires. And cheese.
So I don't know.
Cheese.
I'm not like the expert when it comes to stuff like that. But I've never heard of like ice cream with 1% or 2%. Usually it's full fat. You need like the fat to make the ice cream. So milk is a iffy kind of thing. I'm not a fan of a whole lot of milk. But if you're gonna have milk, absolutely never have 1% or 2% milk for the rest of your life, basically.
Okay. What is the other one?
Okay, so the next one is like the red meat. If you're gonna eat red meat, don't eat the ones with antibiotics and crap in them.
And what are the antibiotic ones? Let me move you.
Stay away from anything injected with antibiotics. Those are hormones. Antibiotics mess with your gut microbiota. You don't want any hormones. So if you're gonna, don't do them with hormones and steroids.
And what else? One last one.
So, don't kill me, but avoid the sugar.
Oh yeah.
I
thought you was gonna say French fries because you be hating on me and my starches.
And your rice.
Am I right?
Like, girl, can you have some cauliflower rice or?
I know it's not rice. It's not rice. Stop lying to us. Okay.
You and your rice, girl.
Am I the only one that love rice here, guys? Leave a one in the comments if you love rice like I do, because she be getting on me, and I'm a Caribbean woman. I need my rice.
It's not that good. Rice
it's
not
delicious.
Girl.
Okay.
I'm from Africa. We make this cornmeal type of dish.
Yes. I don't like cornmeal. I want rice. I want potatoes. I want plantains. I want pasta. All the things you keep me away from.
Girl, I won't even go into the pasta.
Oh my God. Okay. All right, guys. Look, they said I like my fried rice. All right. What are 3 things women should definitely have more of if they're trying to have food-wise, trying to have children?
Number one, please, I need your bowel movements to be going. That's a big thing I work on, is bowel movements. So high fiber foods. So we need to be going to the bathroom like 2 to 3 times a day, ladies. So if you're plugged up, that's a problem. We need to help with that. Another thing that you should be eating is, this is a general comment, but varieties of colors. So whenever you're juicing or whenever you're eating, whenever you're looking at your plate, there should be multiple colors on there. So the different things are excellent for you. And then the third thing that I'm going to add in is good quality meat. You need meat. Meat has, I mean, think about B12. You know, there are certain things that you really need for
I love my meat.
You need iron, you need B12. There's a lot of, you need that protein. You need good protein, and meat gives you
One
that.
of the things I was really surprised with when I did your detox, when I started with my detox stuff, was the fact that you advocate like bone broth.
Oh, yeah.
Yeah, you're like a fan of it. I'm like, what the hell?
Look, even all the way up to pregnancy and whatever else, bone broth is absolutely amazing. Drinking it by itself, if you can do that, that's great. Making it, putting it, adding it in soups, don't boil it though. Bone broth is absolutely incredible. I mean, you're having good collagen in there, you're having good nutrients in a shot. I mean, it's incredible.
Oh, okay. So Michelle is going to try to come back in for her question before we leave. Michelle, I think you have to leave again and come back in, and then you can send the request. That will probably be helpful. She sent me a text.
Someone said meat makes them feel sick most of the times. Okay, so that could be an indication of something. All right, so it depends. I can't like I don't know you, so I can't like, you know, say anything specific. I can just share my story. So after I had my son, I had some issues where meat was making me feel a little sick. So that could be some imbalances in your gallbladder as well. Maybe your body's having like just some issues kind of processing that meat, or like sometimes whenever you're around like Burger King or any fast food place, that smell kind of makes you want to throw up a little bit. So yeah, for me that was some issues, some gallbladder issues.
Yay!
Wow. Okay, so and
can you see me?
that she said that as far as meat, the meat has to be organic. Okay. Yeah, we got Michelle back. Perfect timing. Ask your question. Boo.
Okay, so my question is, I've been struggling with very painful periods. I have 3 children, 11, 7, and 2, and I noticed that after giving birth to each one of my children, which were all natural, my periods have been very, very painful. The doctor seems to think I have endometriosis. And whenever I'm ovulating, before ovulation, even after ovulation, I get painful cramps so bad that it goes into my rectum to the point where it feels like I'm giving birth. And the doctor wanted to recommend that I get my uterus taken out, but I was afraid because I'm still young. I'm only 34, and they're like, you need to get your uterus taken out. So I don't know what to do for the pain because it's excruciating. It's debilitating. And my periods are very, very heavy. I'm very petite. 100 pounds, 4'11", and I lose a lot of blood every time I have my periods. It's so painful that I can't do anything on the first day.
I'm so sorry that you're going through this. Endometriosis is a horrible thing. It is, in my opinion, it's the toughest to kind of get at. So there are a few things that you can do to kind of calm down that tissue. So basically, for those that don't know, endometriosis means that in the lining of your cervix, which is what you shed every month on your period, you've got excess tissue there. So that causes very, very painful periods. I mean, imagine like when you have the lining of your cervix coming out during your period, it's pulling out big chunks of tissue that are there.
Yep.
So that hurts.
Right.
And so there's some things that you can do to alleviate the pain. Castor oil packs can be helpful.
Okay.
Like red raspberry leaf. There's some herbs that can help you with pain. Do you know what stage your endometriosis is in?
I don't know, but I'm just afraid that it's progressing because I'm more concerned of the pain in my rectum. It's literally in my rectum. It's across my pelvic area, but in my rectum, as if somebody's literally drilling in there. Like that's the only way. I don't mean to be so descriptive, but it feels like I'm pushing a baby out. Like when I had my kids, it felt like the baby was coming out of my rectum. I had like back labor and stuff, and I'm literally screaming. Like I break out in a sweat because the pain is like contracting. It's so intense for like a good 30 minutes, and then it'll subside. And then I discharge a lot when I'm ovulating. Very, very, a lot of like clear discharge, not anything abnormal, but it just changed after I had my children. My children are all healthy, beautiful, but my body just totally took a turn for the worse after pushing them out. Like my body never went back to normal.
So I like when I hear that, I can feel the pain. Like I can feel your pain when you're saying why I do what I do. So typically, I can help women that have stage 1 and 2 endometriosis. Stage 3, I just help with the pain. So I'll use herbs and different things just to ease the pain. Stage 4 is just a whole nother ball game that is beyond my control on the natural holistic end. So I would say, if you were diagnosed with endometriosis, you can find out what it is.
Well, they never went and did the test. She wanted to do the test where she goes in laparoscopy, like the laparoscopic way to see it. But she said that I was still young and she didn't want to like do surgery. But she said all of my symptoms, and when I get my checkup, she's like, "This is what you have, honey." And the first thing she told me was to get my uterus removed. And I freaked out because I don't want any more kids, but I know that I'm not ready to go through that transition in my life right now at 34 with like, you know, all of the hormone changes, and that's a big organ that's in my reproductive. So it will make me feel less than a woman, you know, at this young age.
Yeah, so I'm not accepting, I'm not agreeing with that because they haven't looked at the tissue to make sure it's endometriosis. They're telling you that they want to remove your uterus based off of something that they haven't even diagnosed. They haven't even looked at the tissue.
So they did do another test when I went. I forget the name, but they injected dye.
Okay.
To me, that was very uncomfortable, and they did notice something where they said my uterus looks beautiful. It's shaped beautifully, but they did say they noticed that it was thicker. The lining was thicker, almost like when you're pregnant.
Okay.
But I mean, I haven't even been able to go see a GYN because they're booked up. When I called to get my checkup, they're like, the closest is in 2 to 3 months. And I'm like, I need to check up with my body. So I've honestly just been dealing with it. I take Tylenol or a heating pad, and I'll just, you know, ball up and, you know, put my knees in and try to just pray that the pain subsides. And eventually it does. But those couple of minutes, it's literally like giving birth again, all over every time.
Okay.
Wow. Yeah, you should do her detox too. It sounds like it would be helpful.
Yes.
You can hit me up.
Okay.
Things that I would try first on a holistic aspect to kind of ease the symptoms. If those work, then there's a chance of possibly reducing the tissue. But I don't know what stage it is. So
right.
It will be helpful if I know the stage, but I can definitely help your period symptoms.
Okay.
And if you're just at a stage 1 or 2, then hey, this is something that we can work at in the long term to
my last question for you, I didn't mean to stop you. Can endometriosis turn into cancer, or it's just like a condition? It's not like a disease. Is it a disease, or is it
very so endometriosis is an autoimmune disease.
Oh, okay.
Very rarely does it turn into cancer.
Okay.
Yeah.
Okay.
Yeah.
In my lifetime, I've never personally met anyone or worked with anyone whose endometriosis has turned into cancer. But then again, they get to me before it progresses too bad. But I don't know anybody whose endometriosis has progressed into cancer. Very, very rare.
And you know what's weird, real quick, and then I won't hold you. I also have fibroids, so very small ones in my uterus. And I get cysts on my right ovary all the time. And I feel that they bust because a whole bunch of fluid will come out and the pain goes away. The weird thing about it, I was going through that when getting pregnant. I've never had trouble getting pregnant by the grace of God. And I was having, you know, trouble with the fibroids and stuff like that. But the endometriosis came after my children.
You know, I was actually, I wasn't going to say it on here, but I was going to say it sounds like you have a low-grade endometriosis fibroids that we're talking about with ovulation. Points. I didn't want to say your business.
Oh, it's fine. I'm open. I'm fine.
She was like, I wanted to tell you in private.
Yeah.
Oh, it's fine. It's fine.
Yeah. So it sounds like that. It could be like a low grade endo, but then you have like a fibroid that's right there by the endometriosis tissue, by the endometrial tissue. And so that's what's causing you like excess pain.
But why does it go? I know that the uterus is close to like the rectum and all that, but like why does it go into the back area? Like that part is excruciating. Like why does the pain come from right there?
Likely, and I don't have a scan to prove this, likely what can happen is the nerves are close to one another. I don't know if you've ever had a situation where like maybe you cut yourself here, but then you feel like pain like somewhere else. Because of the pain, the nerves are connected. And so
almost
that's
like, almost like when you get a toothache, your ears or your glands will hurt, you know, because it's all connected.
Or your head. Yeah.
So that cervical tissue is very close to the rectum. And so you'll feel that pain, especially if you have like a double dose of endometriosis plus a fibroid and a whole lot of issues there. I can imagine.
I know. It's a lot. It is a lot. But thank you so much. I will definitely like write you separately. I like your vibe. You seem very like you know your stuff. And you're an African American woman. I always wanted to have a black doctor, you know. All these other doctors, no disrespect to any other, you know, but they can't relate, and they don't give like Yumi said, they don't give you that comfort, that assurance, and they're not thorough. They just brush you off real quick in and out. And I need somebody to take pride and take time with my body.
Yeah. I got you.
That's why I love Dr. Vita. If you just joined us, please follow Dr. Vita.
I will follow her, yes.
Please follow Dr. Vita K and check out her services that she provides. I am on her detox. I love it. She has helped me with my fibroids a lot.
Okay.
Finally, before we leave, I want you to talk a little bit about herbs, Dr. Vita, and why is that your choice of method to help each client? Because you know I love my herbs.
Oh my gosh, herbs are like, I love herbs, okay? I love herbs. There are thousands of herbs that are out there, and their whole purpose is to help us, okay? Let me turn this slide up a little bit. So there are just, God put them on this beautiful earth just for us. And so there are herbs that can heal certain parts of our bodies that just have these wonderful qualities. And the way that I look at herbs is they're there to help me, not to harm me. And so you should look in my house. I have so many different herbal collections. I've been playing around with herbs maybe like 12, 13 years. And so I like them because they're gentle most of the time. They're able to tonify reproductive issues. They're able to, whatever you're having, stress, whatever issues that you're having, herbs can provide help. They can provide healing. They provide nutrition. They're absolutely incredible. So that's a big part of my process. I don't just tell people herbs to take. You have to be in a detoxified state. You have to be living a healthy lifestyle so that the herbs can come in and add to it. I don't ever recommend somebody that is living an unhealthy lifestyle start consuming herbs, because herbs are supposed to come in and add to your health. Okay.
Yes.
So that's part of my. Most people, I don't give any herbs. I don't recommend any herbs until you've gone through a certain process, and I know that your body's ready for them.
And I can attest to this doctor. That's why I had her here, guys. Dr. Vita, thank you so much for your time. Thank you for your grace. Thank you for always offering so much to all of us. Thank you for doing the work so that you can be a blessing to all of us. I'm so excited about your book. I want you to tell people where they can find you, your services, and your book one last time before we leave.
Well, everyone, you feel free to DM me. Get at me on here on my Instagram, Dr. Vita K. TikTok is on and popping. Come over to TikTok. We can laugh together.
Your TikToks and Reels are so funny.
Come on over to TikTok, Dr. Vita K. I'm launching a brand new website with a new domain. That's drvitak.com. So that will be launching with a blog. That blog is going to have so many resources for women that have irregular periods. That if you want to get into herbs, it's going to have good blogs on herbs, skincare products that are non-toxic. I mean, there's
your YouTube channel.
I have a YouTube channel, Dr. Vita Natural Health. So you can find me there. Just wherever. Don't be afraid to DM me. I have people that send me pictures of their period blood, of their discharges. Like, don't even feel like, I mean, that's what I'm here. That's what I do. So it's not even like, ooh.
I think it's important that they do reach out, but I also think it's important that you pay her for her services. One of the biggest things that I advocate, and you all know that, guys know that, especially as a Black woman doctor, is that you can take all of this information but not have the reciprocity. It's really important that if you want to change in your health and you want something different, you pay the person that has gone to school, but also know what you're going through. Pay them properly so that they can support you and help you, because this knowledge is not for free. It is not for free. So ask some questions, but also make sure that you are supporting and investing in Dr. Vita, you know, because I'm about that.
Oh, 10 years of school.
10 years of, Jesus, 10 years of school, guys.
10 years of school. Woo!
It couldn't be me. It couldn't be me. Praise God for people like you. 10 years of school and still choosing to do it holistically. Oh, I forgot to ask one last question. You don't really like the pills, right?
No, it depends on
birth control pills, excuse me.
Oh, no. I definitely don't like birth control pills. I mean, like, I can't tell you not to take them because it depends on your situation.
Right.
But however, common, I'm not a fan. So if
just know there's a reason why this doctor is saying that.
Yeah, avoid them. I'm not telling you what to do. I'm just telling you, be careful.
Avoid them.
Know that there will be consequences to you. Whatever you put in your mouth, whether it's good or bad, there are always going to be consequences to whatever you put in your mouth and on your skin.
Woo! Well, that's it. Thank you so much, Dr. Vita, for being here. You guys, if you need this, I'm going to save it. It's going up to be on our Instagram, what is it? IGTV, our IGTV. So you can check this out, and then please follow Dr. Vita. Get down with her services and support her and share her stuff. Share her stuff so other Black women can find doctors like her to help them in their infertility journey, their period journey, and their fibroids journey. Okay? Thank you so much, Dr. Vita. I love you. You have a very special place in my heart.
Love you too.
Bye, everyone. I'm gonna end this now, Dr. Vita.